Benchmarking in healthcare. Benchmarking is a crucial process for organizations looking to improve their performance by comparing themselves with best practice organizations. The goal is to identify areas for improvement, enhance the quality of care, increase efficiency, and optimize patient outcomes. This comparison involves measuring the services, processes, and outcomes of a healthcare facility and helps to identify areas of improvement, set realistic targets, and implement strategies to achieve excellence. Key components of healthcare benchmarking. Identifying benchmarks. This involves selecting metrics or key performance indicators, KPIs, relevant to the organization's goals, such as patient satisfaction, treatment outcomes, or operational efficiency. Benchmarks can be based on internal data, historical performance, or external data, industry standards or best practices. Data collection. Accurate and consistent data collection is essential. This can include clinical data, e.g. patient recovery times, operational data, e.g. average length of stay, or financial data, e.g. cost per procedure. Comparative analysis. Once data is collected, it is compared against the chosen benchmarks. This analysis helps identify gaps between current performance and the desired standard. Identifying areas for improvement. The comparison will highlight areas where the healthcare organization is underperforming. These areas become the focus for quality improvement initiatives. Implementing changes. Based on the benchmarking results, the organization implements changes aimed at closing the performance gaps. This may involve process re-engineering, staff training, adopting new technologies, or revising clinical protocols. Continuous monitoring. Benchmarking is an ongoing process. Continuous monitoring ensures that the implemented changes are effective and that the organization adapts to any challenges or standards that arise. Benchmarking can be classified into several types. 1. External benchmarking, comparing performance against other healthcare organizations, either regionally, nationally, or internationally. 2. Internal benchmarking, by comparing performance metrics within the same organization. For example, a hospital may compare the performance of different departments, such as cardiology versus orthopedics, to identify best practices and share successful strategies internally. 3. Competitive benchmarking. Here, the organization compares its performance against direct competitors. In healthcare, this may mean comparing one hospital's patient satisfaction scores, readmission rates, or treatment outcomes with those of nearby hospitals or facilities operating in the same market. 4th, functional benchmarking, comparing specific functions or processes, such as patient admissions or medication management. 5. Process benchmarking. This type specifically zeroes in on evaluating and comparing processes. For instance, a hospital might benchmark its surgical procedures, emergency room protocols, or patient discharge processes against those of top-performing institutions. This can help streamline operations, reduce waste, and enhance patient care. 6th, generic benchmarking. This involves comparing one's processes and performance metrics with those of leaders across a variety of fields. This method can inspire new ways of thinking and highlight innovative practices that can be adapted to the healthcare setting. 7. Strategic benchmarking, comparing overall organizational strategy and performance. A healthcare organization might compare its long-term strategic planning, investment in technology, or methods of scaling services with those of industry leaders. This helps ensure that they are positioned for sustainable growth and can better anticipate future challenges. Common areas for benchmarking in healthcare. In clinical outcomes, for example, mortality rates, infection rates, readmission rates, patient satisfaction scores. In operational efficiency, for example, staffing levels and productivity, turnaround times, and resource utilization. In financial performance, For example, revenue, expenses, and profitability. In quality improvement initiatives, for example, patient safety and adherence to clinical guidelines. Benefits of benchmarking in healthcare. 1. Increasing patient satisfaction. Benchmarking can lead to improved patient experiences and outcomes. 2. Operational efficiency. Benchmarking can lead to more efficient use of resources, reducing costs and waste. 3. Enhanced quality of care. Continuous improvement based on benchmarking data can raise the standard of care provided. 4. Regulatory compliance. Benchmarking helps ensure that organizations meet industry standards and regulatory requirements. 5. Competitive advantage. Organizations that consistently benchmark and improve can achieve a competitive edge in the healthcare market. 6. Enhancing staff. Morale. Recognizing and celebrating areas of excellence can boost staff morale. 7. Supporting strategic planning. Benchmarking data can inform strategic decision-making and help organizations set realistic goals. Challenges in healthcare benchmarking. 1. Data quality and availability. Ensuring accurate and reliable data is essential for effective benchmarking. 2. Comparability. Identifying organizations with similar characteristics and ensuring that data is collected and analyzed in a consistent manner. 3. Cultural barriers. Resistance to change and organizational culture can hinder benchmarking efforts. Tools and techniques. 1. Statistical analysis, using statistical methods to identify trends and patterns in data. 2. Benchmarking databases, utilizing databases that collect and analyze benchmarking data from healthcare organizations. 3. Quality improvement frameworks, employing frameworks like Lean Six Sigma or Plan, Do, Check, Act, PDCA, to guide benchmarking efforts. By effectively implementing benchmarking practices, healthcare organizations can drive continuous improvement, enhance patient care, and achieve sustainable success. In summary, benchmarking in healthcare is a strategic tool that, when effectively implemented in the quality of care, lead to significant improvements in the quality of care, operational efficiency, and overall organizational performance.